Hello and welcome everyone. My name is Mohamed Elemary. I'm a hematologist from Saskatoon, and it's my pleasure to be here with you with this interesting panel to review with you some of the highlights from day 2 of the MDS 2021. So I'll just start by introduction, to the panel here. I'll start maybe from the west coast to the east coast. We have Michelle Geddes, and she is a hematologist in Food Health Medical Center in Calgary. And we have John Storring from McGill Health Center in Montreal. And last but not least, we have Mary-Margaret from Halifax. So maybe today was a very exciting day. As you know, there were 4 plenary sessions, and maybe start with Michelle. Michelle, what did you attend today, and any highlights that you want to share with us?
Well, you know what, I went to all of the different plenary sessions today. I think one of the ones that was really interesting was the initial one looking at molecular mechanisms of disease and targets. And there was a really nice talk from Dr. Ebert, who looked at some of the genetic basis of leukemia development and the impact of how many molecular mutations people have, but also the copy number, and how that, together with the cytopenias, can significantly predict the risk of developing malignancies, and also some of the impact on some of the lymphoid panels predicting CLL and lymphoma, and then COPD and CH and coronary artery disease. So it's really interesting to see how the inflammatory component of MDS seems to impact bone marrow disease, but also some of the comorbidities in our patients. It'll be interesting to see how that plays out.
That's quite interesting, yeah. And John, you were the moderator of one of the nice sessions that I attended today. I enjoyed it, actually, the low-risk MDS. So can you just look what was it about, and if you have some of the learning key points that you want to share with us?
Well, I think, Dr. Verma's review of the TGF-beta pathway and luspatercept and the mechanism of action of this new drug was very great, and his discussion about new other potential targets in the NF-kappa beta pathway was certainly interesting. And as well, Dr. Platzbecker gave a great overview of management of low-risk MDS and where we might be going. Certainly gave some very, very useful strategies for clinicians that we can implement now, as well as some ideas of what to expect coming down the pathway. So, great session overall.
Very nice session. Yeah, I agree with you. So, Mary-Margaret, so what have you learned today? Anything stood out for you today from the sessions?
Yeah, I was actually able to attend all the sessions other than the low-risk MDS. I had a conflict with that, so hopefully I can watch that if it's on demand later. But yeah, just to echo what Michelle said, really interesting, just learning more and more. Like MDS, is one of the speakers said, it's just in its infancy, and kind of really learning about what it is in the pathophysiology and how that works.
Am I paused?
Is my, are you losing me? Yes. There goes my internet.
We have you back.
I don't know, can you hear me? Everyone's moving now. I was frozen and everyone else could hear me? No. Did you catch any of that? No. Hello?
I can hear you.
You might want to repeat some of that.
Yeah, I know. I don't know where it did. I saw that everyone else froze, which meant that I was probably frozen. Yeah, just interesting in terms of the pathophysiology, talking about the bone marrow fat and inflammation and clonal hematopoiesis, and just some of the talks around that were quite interesting that I'd never really heard about before. And I always really enjoy hearing about the germline mutations and the importance of looking and thinking about those, and certainly a little bit biased to Dr. Godley's because we now have one of her trainees at our center. So we're always talking about that now and doing skin fibroblast testing. And so that was really nice sessions to hear.
Those were universally excellent sessions in that hereditary session. All the presentations were really clear and really thought-provoking about what are we doing, and especially when you get around questions of transplant.
The other thing was this molecular IPSS score, which has been now developed looking at some of the most important genes and now some extra restrictive genes, and looks at the importance of biallelic TP53, as well as both, they put FLT3 ITD and TKD mutations together, and then the MLL, which we don't routinely do at our center, and that could be potentially practice training. It's not in all of the myeloid gene panels that we do now, but looks like it's going to be quite important as these new molecular predictors come together with bioinformatics, which is a really exciting way of integrating this knowledge into patient care.
What struck me about that was that almost half of the patients in our sets were reclassified from their IPSS-R to a different level of risk, which tells us that, we're still not doing a great job at assessing and categorizing patients. And this will probably make us just that much better at, how to pick patients for the right therapy.
Yeah, and most of them going to higher risk. Yeah, that was an exciting talk to see, and nice to know that calculator will be out at some point. They didn't mention when it was going to be published, but it was great to see and hear all that.
Great. So the virtual platform, actually, I enjoyed it a lot. And, I'm not sure, Michelle, if you had the time to take a look on the e-posters. They were laid out in a very nice and friendly way that you can just navigate through them in a very easy way. Anything that you want to share with us from the e-posters?
I haven't looked through all of the e-posters yet, but it's a nice integrated way in all these sessions where they're having people do poster presentations as part of the plenaries. So it's a really good overview of some of the big posters. So I'm not sure if one of my colleagues wants to comment on the e-posters.
Take a look at e-posters.
Again, the day was full with the plenary sessions themselves, but it was nice having the very quick overviews. There were definitely some interesting posters I'm going to go back and look at from my sessions. But.
Yeah, I think they'll be available to the end of December. So.
Yeah. I didn't get a chance to look at them today either, but definitely will check them out.
And the virtual, meetings that we have on demand for a few months after. Yeah, that's good. So tomorrow's agenda is very exciting. So there are some difficult clinical cases, and there is live debate tomorrow for personalized MDS therapy between Garcia Manero and Luca Macrovati. So what are you planning to attend tomorrow? Are you planning to do full everything, or what are your thoughts about tomorrow?
Definitely the clinical cases. I'll be helping moderate the high-risk session, so that'll be exciting. There's some really good posters in there as well, so I'm excited to be able to hear people's questions about those.
Yeah, as a transplanter, I always look forward to hearing Corey Cutler, who will be there, as well as Dr. Sakaris. And I'm sure he's going to talk about what happens after HMA failure, which I think is still our big question in treating high-risk patients.
And Mary-Margaret, what are your plans tomorrow?
I haven't really made them fully, but definitely the clinical cases and the debates are always interesting and bring up a lot of good controversial points either way. So probably try and catch those ones.
Great.
There was another session from this morning that I'll go back to. It was one of the learning sessions. So Dr. Ali Carson did a session on using the myeloid mutations in diagnosis. And so I think that's a really good one to go back to on demand if people haven't had a chance to see it.
That's great. That's good advice for other participants. So any other highlights that you want to share with us from today's sessions? Okay, then I would like to thank you all and thank the viewers for joining us, and thank you the panelists for sharing their highlights from today's with us, and have a good evening and hope you have an amazing conference day tomorrow. And thanks so much.